When it comes to orthopedic appliances, you have many choices. You can use sagittal appliances, transverse only, combination of sagittal transverse, occlusal coverage, and many different choices when it comes to clasping. For example, the first appliance we have here is an upper three-way expander. This appliance is used to drive the premaxilla forward sagittally, and you also have transverse gears that will develop transversely. Lower arch, you have the same choice. You can use a midline screw to develop transversely and also sagittal gears. Depending on where you put the split and place the gear will depend on whether you move the lower anteriors forward and/or distal drive molars. This appliance is a two-geared Swartz plate, which strictly develops transversely. Anytime you have a long arch, you can choose two gears. Shorter arches, you can just use one gear. This is a lower Swartz plate used to develop transversely. This is an example that has many different clasps, and that will depend on the dentition on which clasp we choose. You can work with your lab to decide what type of clasping you prefer. This is an upper Swartz plate as well. Upper three-way with Adams clasp and hooks for a tandem bow. This is an upper sagittal with occlusal coverage. This is strictly used to drive the premaxilla forward. One of the reasons you would need occlusal coverage is if you have an anterior crossbite. You add posterior acrylic to build up the bite so you can clear the anterior crossbite. Also, if you have an anterior open bite, you can place occlusal coverage, which will help close the bite down as the patient wears the appliance by intruding posterior teeth. No transverse gear is added. This is an upper Swartz plate with occlusal coverage, upper three-way with occlusal coverage and labial bow. Upper three-way with tongue wires and spinner. If the patient has a tongue habit, these wires are used to deter the tongue in the anterior section.